According to current research, about 1 in 3 adults have metabolic syndrome, which is a cluster of conditions that cause or significantly contribute to several chronic diseases including type 2 diabetes, chronic kidney disease, non-alcoholic fatty liver disease, polycystic ovary syndrome, PCOS, heart disease, stroke, and several types of cancer including breast, colorectal, pancreatic, and liver cancer. Metabolic syndrome is characterized by high blood pressure, elevated blood sugar levels, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. Among other factors that contribute to metabolic syndrome, the deficiency of the hormone, glucagon-like peptide 1, also known as GLP-1, plays a critical role. This GLP-1 hormone is produced in the small intestine in response to food intake, especially carbohydrates and fats. The deficiency or impaired action of GLP-1 can disrupt critical metabolic processes, leading to the development of metabolic syndrome. The impact of GLP-1 deficiency extends beyond the individual components of metabolic syndrome. GLP-1 has anti-inflammatory properties and helps reduce oxidative stress, both of which are important for cardiovascular health. Moreover, GLP-1 receptors are expressed in various tissues, including the heart, blood vessels, and brain. The effects of GLP-1 on these tissues suggest that its deficiency could have direct negative impacts on cardiovascular function and cognitive health, both of which are increasingly recognized as being linked to metabolic syndrome. Now, how exactly does metabolic syndrome contribute to the chronic diseases mentioned earlier? Number 1, metabolic syndrome and cancer. Insulin resistance, which is a core feature of metabolic syndrome, leads to hyperinsulinemia, where the pancreas secretes more insulin to compensate for the reduced effectiveness of insulin in tissues. High levels of insulin and insulin-like growth factors, IGFs, promote cell proliferation and inhibit programmed cell death, also known as apoptosis. This can lead to tumor growth and cancer development. Obesity, which is a state of low-grade chronic inflammation, is a central component of metabolic syndrome. It creates a microenvironment conducive to cancer development by causing DNA damage, promoting genetic mutations, and supporting tumor growth and progression. Metabolic syndrome, particularly in women, can also lead to increased levels of estrogen due to excess adipose tissue, which produces estrogen independently of the ovaries. Elevated estrogen levels are associated with an increased risk of hormone-sensitive cancers, such as breast and endometrial cancers. Number 2, metabolic syndrome and chronic kidney disease, CKD. High blood pressure, a key feature of metabolic syndrome, damages the blood vessels in the kidneys, reducing their ability to filter waste effectively. Over time, this damage can lead to the development of CKD. Prolonged high blood sugar levels, typical in metabolic syndrome, lead to glycation of proteins and lipids, forming advanced glycation end products. Advanced glycation end products contribute to oxidative stress and inflammation in the kidneys, exacerbating kidney damage and accelerating the progression of CKD. Similar to its role in cancer development, chronic inflammation in metabolic syndrome also plays a critical role in the progression of CKD. Inflammatory cytokines and oxidative stress damage the kidneys glomeruli, leading to glomerulosclerosis and reduced kidney function. Number 3, metabolic syndrome and polycystic ovary syndrome, PCOS. Insulin resistance in metabolic syndrome leads to hyperinsulinemia, which exacerbates the hormonal imbalances seen in PCOS. High insulin levels stimulate the ovaries to produce more androgens, or male hormones, such as testosterone. Elevated androgen levels contribute to the symptoms of PCOS, including irregular menstrual cycles, hirsutism or excess hair growth, and infertility. Obesity, particularly central obesity, is prevalent in women with PCOS and is a major component of metabolic syndrome. Excess adipose tissue exacerbates insulin resistance and increases the production of androgens, worsening the symptoms of PCOS and contributing to its progression. Number 4, metabolic syndrome and non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease ranges from simple steatosis, which is fat accumulation in the liver, to non-alcoholic steatohepatitis, which can progress to cirrhosis and liver cancer. Insulin resistance leads to increased free fatty acids in the bloodstream, which are taken up by the liver and stored as fat. This fat accumulation in the liver cells is the hallmark of non-alcoholic fatty liver disease. The accumulation of fat in the liver cells can lead to lipotoxicity, where toxic metabolites of fat induce liver cell injury, inflammation, and fibrosis. This process is a critical factor in the progression from simple steatosis to non-alcoholic steatohepatitis and cirrhosis. Now, what are the ways to increase GLP-1 levels to help avoid or cure metabolic syndrome, thus treating these chronic diseases? Eating high-protein foods such as fatty fish, chicken, eggs, and plant-based options like tofu can help stimulate GLP-1 release. Consuming foods high in soluble fiber and healthy fats, such as beans, apples, sweet potatoes, avocados, and nuts, can also enhance GLP-1 production. Prebiotics and probiotics from foods such as yogurt, sauerkraut, kimchi, and high-fiber vegetables help with a healthy gut microbiota, which plays a significant role in the regulation of GLP-1 secretion. Staying well hydrated also supports digestion and nutrient absorption, which are essential for maintaining optimal GLP-1 levels. There is very recent research that shows that hydrogen sulfide impairs GLP-1 secretion. The study published in July 2024 highlights that bismuth subsalicylate, which is the active ingredient in Pepto-Bismol, can block the production of hydrogen sulfide by certain gut bacteria, such as Desulfo vibrio. The study further found that bismuth subsalicylate plays a role in increasing GLP-1 levels, which can positively impact metabolic function. In another 2024 study, it was shown that participants who received GLP-1 treatment had significantly reduced risk of obesity-related cancers.